Hello guys, welcome to my channel once again, where we make videos that cover all you need to know concerning medical doctors and medical students. And welcome to the 5th episode of the Questions Doctors Will Love You to Ask Them series. And in today's video, we're going to discuss on questions you need to ask your doctor during your antenatal care visits. Now this video is dedicated towards pregnant women that have started antenatal care in an established hospital. These 8 questions will help capture a lot of information you need. If you're new to this channel, please do well by subscribing and turning on the bell notification so you don't miss my new videos every week, that's Saturdays. And to my returning subscribers, thank you very much for coming once again. I appreciate you from the bottom of my heart. Now let's dive into today's video. So let's quickly define pregnancy. Pregnancy can simply be defined as a period in which a fetus develops in a woman's uterus or womb, as you know it to be. So till it develops and eventually is being expelled, and that's called birth or delivery. But then for fun's sake, I would want to give you some other names for pregnancy. It can also be known as parturiency, gestation, or gravidity, as the case may be. Just add that into your knowledge folder. Who knows? Usually most women confirm pregnancy by the use of a pregnancy strip, either a urine or a blood stream. But know that pregnancy is confirmed with an ultrasound scan, because the strip just shows that there's enough circulating hormones of pregnancy in the body. But then it doesn't state whether the pregnancy is still viable or not. You could lose a pregnancy and it will still show that you're pregnant. Sometimes there are some conditions that might mimic pregnancy hormones, and the pregnancy strip will pick them. Fun fact, if a man pees on a pregnancy strip and it is positive, the man should immediately go to the hospital. It might be a worrying sign. But then you cannot confirm pregnancy till you've missed your period. So that means you should have known when your period is coming and you've missed it, and then you do a pregnancy test, that's the strip test. If it's positive, you will have to confirm by an ultrasound scan. And usually the earliest, based on some documentations, the earliest you can pick a scan will be around 17 days after your ovulation. So that means the earliest you can pick will be around 5 weeks plus after your last menstrual period. So please don't just do the pregnancy test with the strip and relax. Try if it's up to 5 weeks, which is usually around the time women discover that they're pregnant. Some might miss the period and just overlook it, but subsequently miss the second period and then discover that they're pregnant. So immediately you do the strip test, try and go and do an ultrasound scan to confirm that you're pregnant. Walk to the hospital or walk to a radio diagnostic center stating that you suspect you're pregnant, and this is being done to you. As soon as you discover that, the recommendation is that you book for antenatal as soon as possible. Usually advisable before 12 weeks of gestation, that's before your pregnancy is 12 weeks. So as soon as you discover you're pregnant, it's not too early for you to start. There are a lot of things that will happen within this early period that will be picked soon enough by the doctor and help you avoid some certain problems subsequently. So please don't wait till the pregnancy is big, as most women do. Don't wait, just start antenatal as soon as possible. Normal pregnancy should last for about 40 weeks. In medicine we say 40 plus or minus 2 weeks. That's between 38 weeks to 42 weeks. But ideally there's no obstetrician or there's no doctor that would allow pregnancy to reach exactly 42 weeks. So within the time that the pregnancy is termed, there should be a spontaneous childbirth. And if it reaches close to 42 weeks, the doctor will have to deliver the child. That's the safest time to bring out a child. We broadly divide the period of pregnancy into 3 trimesters, the first, the second, and the third trimester. The first trimester is from when the pregnancy is being discovered till 12 weeks. The second trimester is from 13 weeks to 28 weeks. And the third trimester is from 29 weeks till 42 weeks. The first question you want to ask your doctor concerning your pregnancy will be, how old is my pregnancy? This is quite important. It forms the basis of almost everything you're going to do during an antenatal care visit, because the age of the pregnancy or age of gestation helps to determine the kind of interventions you're going to have. Usually there are two ways we date pregnancy. The first is we could use your last menstrual period, which is the first day of your last menstruation. So maybe you menstruate for 5 days. It's not the day it ends, day 5, that you count your last menstrual period. It's the first day you start bleeding. So I usually encourage women that you try to note your last menstrual period. This is the most reliable means to date your pregnancy. So if you're sure of your last menstrual period, there's a way we calculate it and let you know. So far as you're sure, that is way more dependable. The second option is using the ultrasound scan to do it. The ultrasound scan is not perfect, but then it gives us a precise picture of things. So one of the problems of pregnancy or antenatal care visit is wrong dates. With wrong dates, a doctor could have a lot of problems. The child is supposed to be delivered at the time that the pregnancy is being termed. So if it's being delivered too early, it's going to be a problem. If it's being delivered too late, it's going to be a problem. So please note that your date is very important, and the earlier you know it, the better for you, the better for everybody also. What I usually do when I was in the Obs and Gynae department is that I also let you know when a new week is starting, which day a new week is starting. So maybe if your new week is starting on a Sunday or on Wednesday, it will help you to know that every Wednesday or every Sunday, that's when my new week is starting. We prefer to count pregnancies or age of gestation by weeks, whereas the general populace prefer months. But for every physician, every obstetrician, gynecologist, every doctor that is taking care of a pregnant woman, we work with weeks. So for technicality reasons too, please note that the age of your pregnancy is extremely important. Ask, be sure, and follow up appropriately. Also, please, before you get pregnant, to every woman that is menstruating, try to note the last menstrual period. That's the first day that you started your last menstruation. It will come in handy subsequently. The next question I want to ask will be, what should I be concerned about my history or my health condition for those who have a pre-existing health condition that will affect this pregnancy? One thing about pregnancy is that your history is extremely important. At all times, the doctor is supposed to take a detailed history of everything that has revolved around you, the obstetric history, the gynecology history, the medical and surgical history, and your family history too. Because whatever happens, we will likely reoccur. So when these are being noted, it helps us to prepare ahead of time on how to intervene adequately. So you ask this question so that the doctor will be able to list it to you that this is what can put you at risk. If there are things that can be avoidable, this is how to avoid them. If they are not avoidable, it will help you to know how to detect them early and what to do. We are dedicated to ensure that for every woman that books in a good hospital, your contract is terminated when you're safely delivered and you're fine after your postnatal review. No doctor feels successful if a pregnant woman comes in and she doesn't deliver. It's a failure to us. So we'll play every role possible to ensure that you deliver safely and you're safe afterwards. Another thing I want to also note is that please try not to hide anything from your medical doctor. It's important that your doctor knows everything that's happened to you. Maybe there are some histories that you're not really proud of. Please let us know. The third question we want to ask will be, what changes will my body experience while I'm pregnant? Note that pregnancy comes with its own wahala, that's the term we use in Nigeria. It comes with its own challenges. So your body will not be the same. There are a lot of physiologic changes that happen in a woman's body in order to be able to accommodate the child properly. And this might be as mild as a mild weight gain to acne and a lot of other changes. You might get darker, you might get fairer, you might have a lot of bodily changes. You wouldn't be the same person you were before. Don't worry, they are transient. As soon as you give birth, almost all these things get reversed. It helps you to be mentally prepared and just know that it's just transient. It goes with time. Your body reverts back to its normal form after delivery, not usually immediately, but a few months after that, your body will be almost the same as before you give birth. There's a lot of stigma that surrounds the changes around women when they're pregnant. Just know that your body is just trying to take care of the child inside the womb, and it will do anything to ensure that you and the child are okay. You might not look as beautiful as before, and you might notice some certain things that are quite uncomfortable, but don't worry, these changes will be changes that happen within 9 months, so you don't expect them to just reverse immediately, but over time you'll be fine. So ask and the doctor will let you know. The next question you want to ask will be, how often will I be coming for my antenatal care visits? Ideally, the recommendation is that from when you notice that you're pregnant till 28 weeks of pregnancy, your antenatal care visit should be once every 4 weeks. Then from 29 weeks till 36 weeks, you would be coming every fortnightly, that's every 2 weeks. And from 36 weeks upward, you'll be coming every week till you deliver. Please note that. But then in developing countries in which access to a hospital is quite difficult, the WHO recommend that a woman should have at least 4 antenatal care visits. The first should be before 16 weeks. The second visit should be between 24 to 28 weeks of pregnancy. The third should be between 32 to 34 weeks of pregnancy. And then the fourth should be between 36 weeks to 38 weeks of pregnancy. That's for those that cannot have access to a proper healthcare facility. However, if you're watching this video, it means that you're in an urban area and you can access this thing. So please follow the standard recommendation. Please make sure you're faithful to your antenatal visits. Then the next question concerning that you will ask will be, what will be done for me? Apart from the doctor asking you how you're feeling, the doctor will examine you and check the baby and see whether it's growing, and there's a series of tests we do during pregnancy. Please note the tests and also ask the importance of the test and try to do all your recommended tests. Try to be faithful in all your visits, keep to time, and do whatever is being recommended for you by the doctor. Please, if there's any time that you wouldn't be able to come, you try to reschedule your appointment as early as possible within the appointed time. But as much as possible, I advise that you stay and attend all your visits. The next question I want to ask will be, what should I do or what shouldn't I do while I'm pregnant? If you're pregnant, so there are some activities that ordinarily you used to do that are not healthy for pregnancy. The doctor will clearly state them to you. Then there are some drugs that you might be taking initially that are not safe for pregnancy. Please note them. Tell the doctor to know whether it's safe or not safe for pregnancy. There are also drugs that will be introduced to you while you're pregnant. So most of these are drugs that help the baby grow properly, also help you to be healthy while you're pregnant. And in Africa and other countries that malaria is endemic, there's something we call the IPT, which are anti-malarial drugs that we give to prevent a woman from coming down with malaria. Malaria is a serious problem to a pregnant woman and her unborn child. You have more than one visit, so even if you have forgotten some, during a subsequent visit, keep asking. These are questions you don't ask one time, just keep asking. We're patient enough to be able to answer you. We want to ensure that you're satisfied and doing the right thing, because our joy is when you and your baby are safe. And then sex. Normal pregnancy does not prevent sex. But then there might be some conditions that would make a woman and her husband to abstain from sex. So please also ask. The next question we want to ask will be, what are the red flags or what symptoms should I be concerned with during this pregnancy? We'll let you know the ones that are okay and the ones that are not okay. But we want to know the ones that are not okay. And after you know them, the next question you ask is, what should I do when I experience such? The advice is immediately report to the hospital. There's the obstetric emergency unit, so you can walk in at any time. Don't assume you're fine. Please come, let the doctor examine you and tell you that you're fine after checking. Some things that are not really good signs for us will be abdominal pain. Some degree of abdominal pain are not okay for us. Excessive discharge or bleeding from the vagina. If you experience any form of trauma to the abdomen, even if you fell, please don't stay at home. Move to the hospital immediately, amongst other things too. So these are some red flags that the doctor will let you know that these are not okay. As soon as you experience this, please move to the hospital immediately so that you'll be checked. The next question you want to ask, which is very, very important, will be, what are my delivery options? Usually there are just two modes of delivery. There's the vaginal delivery and then there's the abdominal delivery. So the vaginal delivery could be spontaneous or could be induced, and the abdominal delivery is through the cesarean section. I was raised in a part of the world in which women feel good when they're able to have a vaginal delivery. That's when they feel they are women. But it's not true. That doesn't make you a woman in any way. There are some women that cannot deliver vaginally. Please note that no child, irrespective of the route of delivery, is better than the other. So there are some women that wouldn't be able to undergo vaginal delivery. It's very okay. There's nothing wrong with that. It's your choice. The doctor will let you know whatever the options are, and you can choose and plan appropriately towards that. If your choice is not safe for you, the doctor will let you know, especially if you've had previous cesarean sections and you want to deliver vaginally. It's usually not safe, so the doctor will discourage you from having that. If you've been having vaginal delivery, there's nothing wrong in you wanting cesarean section. It's okay for you. If you're too scared to go through labor, the pain of labor, there's nothing wrong with that. You could choose that and plan appropriately. Please, we try to avoid the stigma that's associated with women that do not give birth vaginally. You want to know also who will handle your delivery. Usually for normal, uncomplicated pregnancies, the midwives do that. The midwives are very experienced sets of people. Please note that when you're coming in for labor, the doctor is already aware of that, and he may not or she may not be around to conduct the delivery, especially where there's no indication for a doctor to be there. The midwives are trained, they're professionals, they're very good at their jobs. They'll be able to guide you properly. But then in some cases that a doctor needs to be around, the doctor will be around for that. But then we are a team, we don't work individually. I'm sure during an antenatal care visit in a standard hospital, you see a lot of doctors before you even deliver. So that's very okay. You also want to know what you experience during your delivery, especially if you're going through spontaneous vaginal delivery. You will experience pain, labor pain. But if you want to have a form of anesthesia like the epidural, yes, that could be done. That could be arranged. You could ask for that, and that could be done too. So even for the cesarean section, usually we'll let you know how the process is and you plan adequately, because you have to make that decision based on adequate information being given to you. That's an informed decision. So please ask that and we'll discuss that appropriately with you. They also will ask what you're going to do during that time. Don't worry, that's something that will explain properly to you. The midwife will guide you through. If you are in the delivery room having a spontaneous vaginal delivery or having a vaginal delivery, the midwife will guide you on what to do properly. The doctor is there to also speak to you about that. Then the last question you're going to ask will be, how is my baby doing? Or how are my babies doing? That's for multiple gestations. Please, that's the whole point. Your baby being alive is what keeps us seeing you. So for every visit, apart from you feeling the movement and other things, please ask how the baby is. Every time, let the doctor give you his or her own opinion of it. If it's fine, good. If there's any danger, we'll let you know and then act appropriately to ensure that everybody is safe, baby and mother are safe. So please always ask how your baby is doing, because we're not just interested in you, the mother, we're also interested in the baby. So these are all the questions you need to ask your doctor concerning your antenatal care visit. I know there are a lot of questions that I left out. Please help me. You can comment in the comment section to let me know what I missed. If there's any of the questions you resonated with, or whatever you felt I didn't do justice to, whatever you're not uncomfortable or unconvinced, please let me know. Your comments are extremely important to me. If you are new to this channel, please subscribe and you don't miss my new videos. If you find this video helpful, like and comment. Also you can share with your friends and folks. So see you in the next video. Thank you.